Northeast Network, in collaboration with Indian Institute of Public Health Shillong, Self-Employed Women's Association, Seva, Population Foundation of India and World Health Organization organized two-day regional consultation on universal health coverage in the city on Tuesday, with conversation on universal health coverage with communities from the Northeast. UHC is a major requirement under the Sustainable Development Goal 3 to ensure healthy lives and promote well-being for all at all ages. In light of this, voice from all northeastern states have been brought together in a single platform to deliberate on issues and challenges of public health in each region. Speaker at the consultation includes eminent personalities like Dr. Hildy de Grevy, Team Leader Health System, World Health Organization, Dr. Srinath Reddy, President, Population Foundation of India, Rupa Chinai, and Mumbai-based journalist and writer Dr. Santosh Giri, Executive Director of Kolkata Rista, among others. The discussion that followed brought into light the importance of preserving traditional system of health and well-being in the Northeast and community healthcare providers that must be integrated with the efforts of our governments to extend health service to those that need in the most. Health illiteracy, lack of political will, and difficult terrains are among the many challenges that India's most Northeast faces on its road to universal health coverage.
So on, but equity matters. Equity is a very important consideration. And in order to ensure that the right balance is robust, so there's a dynamic tension between the perspectives of these three groups. And as we progress towards universalization in stages, we need to balance all of these. So they want the service coverage to be extended. The economists and the civil service
Want to make MBBS as your career? We have the best offer at low fee of Rs 16 lakhs onward. Study at the designated location Bangladesh, Nepal, Philippines and Ukraine. In an additional package, we have a trained counselor to give an advice over career counseling, admission, scholarship and visa guidance to ease your process. Since decades, we are at your service with successful placement enhancing the life of MBBS aspirants in the state as well as in the northeastern region.
Central to achieving the Sustainable Development Goals. The United Nations and all the member states who have committed to achieving the Sustainable Development Goals by 2030 have health and well-being as one of the main goals. For achieving the goal on health and well-being for all people in the world, it has been agreed that path to follow is universal health coverage. So the fact that the UN Assembly is going to dedicate a session to UHC is very significant. Universal health coverage, the definition, it will be repeated again and again in different forms from different angles. And I will read it out to you. It means that all people can obtain the quality health services they need without suffering financial hardship. And as you can see from the drawing, the focus is on all people. The young ones, the older ones, the adolescents. Next. Universal health coverage has three core elements. And we want you to understand those core elements very well, because this is what you need to be reflecting upon in the next 2 days. The first one is the principle of leave no one behind. When we talk about all people, that we know that not everybody has access to health care. So understanding who does not get health care. Is it the poor? But within the poor, who is more vulnerable than the other? Where are the minority groups? Are they being given attention when we are providing services? So the concept leave no one behind, please let that guide you in the plans you make, in the way you look at the provision of health care. Because it is about equity, and what is equity? Equity is basically about fairness. Fairness that those who need health care the most actually get it. And in the world of today, that is quite often not the case. The second element, when we talk about UHC,